You all know we're racing the clock right now. We've got until June 30th with the current exemption. We're sending a message to our Prime Minister that this site saves lives here in Vancouver.
We're here to voice our support this morning for the essential health services provided here to hundreds of vulnerable citizens in our city. We're here to say that we care. We care for the people who likely would not access any care or have any access to health care providers if not for this facilities.
How long have you been a drug addict?
12 years.
What drugs are you addicted to?
Heroin and coke.
If you couldn't come here, what would your options be?
In the alley, pretty much.
We all know that over 20 researchers have verified that the Insite program is effective. We have international support, provincial support, municipal support, community support, and scientific and medical evidence. All we need now is for the federal government to simply accept that support and ensure continuation of the exemption under Section 56. Further, I think that this government should consider amending Section 56 of the Controlled Drug and Substances Act to provide licenses and funding for harm reduction centres across Canada.
We must also continue to address the social harms of homelessness and poverty. Ending poverty and homelessness are complementary to very specific harm reduction strategies.
The site has 8,000 registrants. That means 8,000 addicts have registered at the site to use it, with a core of about 3,000 people that use it on a regular basis. And we know that we have now had over 1 million injections take place in this site, and none of those injections have resulted in death.
I can see that it's controversial to some people, but it really shouldn't be. The goal of nursing is to keep people as safe and healthy as possible and ensure that infections like HIV do not spread.
We're at capacity. We have, on an average daily basis, between 600 to 1,100 injections taking place within an 18-hour span. It's the busiest injection site in the world in terms of capacity. The photographs that you see around you are all people, children who have grown up and have made use of this site.
I just want everyone to realize that addiction knows no boundaries, no societal boundaries, no income boundaries, no community boundaries, no race, no religion.
Alexandra was a very happy little girl born into a very loving family. And when she became about 13, she started to have some changes. At the time, there was no safe injection site. So the best I could do was plead with her to please use the needle exchange, which she promised she would do. About a few weeks later, 5-6 weeks later, we got a phone call that she'd overdosed. I do believe that if this place had been open, she would have used it and may very well have got over her addiction.
At a basic level, it's really very simple. Harm reduction is part of professional and ethical nursing standards.
So what's the difference that you've experienced here compared to other kind of health services where you've gone for help?
I've never gone for help in health services on my own. I've been court ordered, and that was the barrier.
Wherever you're at now, we will receive you as a member of society and say you are deserving of health care, whatever that looks like, whether that means a clean needle or a safe place to come where there's a nurse who cares about you, where someone can sit down and talk to you and give you 5 minutes. That's the point of entry that the injection site provides people with, which no other service is able to do because they can't meet them right now today where they're at.
25% of St. Paul's inpatient bed days, which is a huge percentage, are being used for people who have infections related to injection drug use. That's a huge impact on our healthcare system, and it is totally preventable by services such as this.
The most recent analysis that was done was for every dollar spent, $4 are being saved, and that was in the last research paper that was done by Neil Boyd, who reported on that in Ottawa on Monday. How long have you been using?
I'm 36. 25 years.
The idea is here you finish detox, we provide a bed, you stay here for the 2 weeks, 4 weeks that it takes to wait for a bed at a treatment center, and then we move you on to the treatment center.
People who use the injection site are 33% more likely to get into detox and treatment than if they hadn't had access to this site.
I have a start date for treatment already next month. So, but it is hard. It is hard. The lists are long, and for this being such a popular place and such an area where so much people need some help, there has to be more facilities like this, and the people have to have a heart.
And I beg Mr. Harper to please look at the scientific evidence, even if he doesn't want to listen to any of the anecdotal stories.
We're just saying this site needs to be protected and be allowed to continue the work that it's doing to make the inroads to a group of people that are currently not able to access any other form of inroad into the medical care system.
You gonna make it this time?
Yeah.